Hi, I'm Dr. Ajaram and I will tell about sinusitis, and in other words we call as rhinosinusitis. It is self-limited disease affecting to all the ages. So when there is a inflammations or infections, this is causing sinusitis. The inflammations of paranasal sinus and nasal cavity mucosa we call as sinusitis. So when this sinusitis occurs, the most times is chronic, and when recurrent acute sinusitis, when 4 or more than 4 episodes per year is called as recurrent acute sinusitis. So this sinusitis is very common, especially in women and in men also. And what is the cause here? What is the cause? What is the reason for sinusitis? It's a URTI, viral or bacterial infections. Bacterial infection is Streptococcus pneumoniae and influenza, and fungal pathogens, and anatomical abnormalities like terminate atrophy or terminate hypertrophy, nasal mass, nasal polyp, septal device, we call DNS, device nasal septum, and other changes, other cause. So dust, smoke, climate allergy, rainy weather, these all are the cause for sinusitis. What the symptoms you are going to see here? Running nose, nose block. You will feel pain in this area, that is called maxillary area, maxillary pain, maxillary dental pain, headache, fever, and sometimes irritations of nose, and this nasal area and back, like connected to our upper respiratory tract, so feeling irritations. On examinations you will find like nasal polyp or nasal mass, atrophy, or you will find some blockage. So for confirmations you need to go for CTPNS. It will give you confirmations like device nasal septum or nasal polyp or terminate atrophy or hypertrophy, which help you to diagnose, and other CBC, ESR, which gives you allergy or infections. So what the treatment here? So topical normal saline NS, and a topical corticosteroid, and topical antihistamine. So this gives you relief from blockage, and other than topical use like antibiotic orally, like bacterial infections which required antibiotics. A plain amoxicillin is enough, no need to go with amoxicillin with Clavaneck. Antihistamine orally, and decongested medicines orally, and inhalations if required. So like steam, we can say steam if there is a blockage which give you effect, and some precautions which you need to continue, like drinking hot water, avoiding cold area, and avoiding dust and smoke. So use mask and repeated hand wash, and if you are using like tobacco, smoking, or you are working some dust area, please avoid it. and take care. This sinusitis is like irritating too much, and patients are getting it repeated. So see this video and get the solutions. And if you're suffering like this, please be to a doctor and please share this. Thank you.